The Ebola outbreak in Africa has left hundreds dead and many more infected. To halt even more infections, finding and treating all the patients is key. But just as important is finding and monitoring all the people who had close contact with those patients. These people, they may have slept in the same house. They may have come in contact with the patient's body fluids. Now, not all of a patient's close contacts are going to get sick, but those that do can then expose even more people to Ebola. It's called a chain of transmission. I want to give you a real-world example from an Ebola outbreak in the early 2000s. A young woman from Uganda didn't know she was sick with Ebola. She had close contact with 6 people. Her baby and father-in-law, they both got sick. The baby then got his grandmother sick, and she had contact with 2 more people as well. The father-in-law had close contact with 12 people. Out of that, his brother and cousin both got sick. The brother then had close contact with 4 more people, and the cousin had close contact with 5 more people, including another brother who had used his blanket and also got sick. That's how Ebola can spread, from one generation of disease all the way around to another generation, and then another. Breaking this chain of transmission is crucial, and one way to do it is through something known as contact tracing. Basically, disease detectives use every source they can find to find people who may have had contact with a person sick with Ebola. And then for 21 days, they monitor each person, looking for signs and symptoms like a fever. And if it looks like someone is starting to get sick, they're asked to go to an isolation ward. Now, in previous outbreaks, this contact tracing has been pretty effective at halting new transmissions. But the current outbreak is unprecedented in size and scope. The World Health Organization says that so far, more than 8,500 of those close contacts have been identified. Now just imagine that, how daunting it would be to follow for 21 days more than 8,500 people in a region of the world with fewer resources and in remote locations. If you miss even one exposed individual and then they get sick, the virus keeps spreading. This outbreak won't be over until there's been 42 days with no new cases.